So let us understand what is Kegel exercise and what is it used for. It's a very commonly asked question. People say, what are the indications of using Kegel exercise? Is it effective or not? How to do it properly? So we'll try to touch all these topics in this video. I'm Dr. Praveen Tripathi. I'm a consultant psychiatrist and sexual disorder specialist. So first of all, let's understand the concept behind this exercise. Basically, in your pelvis, there is a floor, pelvic floor, which is made up of multiple muscles. We call those pelvic floor muscles. These muscles are important because they help you in controlling various things. They help you control the urination. They help you control the process of defecation. They also help you control the ejaculation process. So if these muscles are strong, you would have better control over your bodily functions. Now, what is the way of strengthening any muscle? It's the same thing. If you go to gym, what are you doing? You are trying to hypertrophy your biceps or triceps or other body muscles. And how do you do that? By repeatedly contracting them and relaxing them. Basically trying to, you put those muscles to work. The more they work, the more is the hypertrophy and the bigger is the muscle mass, and there is more strength also. So the same thing applies here. If you want to strengthen the pelvic floor, you have to put the pelvic floor muscles to exercise. And as you continue doing that, they will gradually become more strong. They'll gradually become strengthened. Now, the first step of these Kegel exercises is to identify the right muscle. It is very important to identify the right muscle, because if you are exercising the wrong muscle, you would get suboptimal results and it may even harm you. So there are two ways of finding out the right muscle. The first way is, say you have the urge to urinate, but you want to stop yourself. You are still away from the washroom and you want to stop yourself. Which muscle do you contract? That particular muscle. Try doing that, and that particular muscle is the muscle in question here. Or say you are urinating and you try to stop the urination in the midstream, you try to stop yourself. Which muscle will you contract to stop yourself? It is the same muscle. The pelvic floor muscles are the one which you would contract to stop the urination. Now, doctors don't recommend to stop the urination repeatedly and do Kegel exercises because it may cause urinary infection. So it's not the best way. The better way to identify the pelvic floor muscles is, again, say you have the urge to go to washroom, you want to pass stools, but you are trying to stop yourself. You have that urge, but you are trying to stop yourself. Again, the muscle the muscle you will contract to do that is the pelvic floor muscle. Or say you are trying to stop yourself from passing the wind. Again, the muscle that you will use or the muscle that you will contract is the pelvic floor muscle. So first step is to identify these muscles, the pelvic floor muscles. Once you have done that, in the second step, you should start exercising in a lying down position. Lie down on a flat surface and put the rest of the body in a relaxation mode. Try to relax as much as possible, and then start contracting the pelvic floor muscle. Contract it for 3 seconds, 1, 2, 3, and then relax. 1, 2, 3. Start doing this exercise while you are lying down. So do it for 10 times. 3-second contraction, 3-second relaxation. Again 3-second contraction, 3-second relaxation. First do it while you are lying down. Start with once a day. As you master it, as you become more comfortable with it, then you can move to the sitting position. You can do the exercises while sitting. And finally, even when you are standing, you can do these exercises, and you can do it like thrice a day and 10 times each. In every sitting, you can do it 10 times. 3-second contraction, 3-second relaxation. Do it 10 times. Now, a couple of things that you must remember while doing this exercise. First is, while doing the exercise, you should not stop breathing. Some people tend to stop breathing while they are doing the exercise. That is not helpful. It is often counterproductive. Secondly, when you are contracting the pelvic floor muscle, sometimes you end up contracting the abdominal muscles too, or the muscles of the thigh, or the muscles of the buttocks. So you have to ensure that you are not doing them. You have to ensure that all the muscles are in a state of relaxation, and you are contracting only the pelvic floor muscles. So when you start doing it, gradually you start becoming better at it. Gradually the pelvic floor starts getting strengthened. And so the question is, in how much time can we expect results? So for erectile dysfunction and premature ejaculation, we say that if you do it twice or thrice a day, usually in a span of 4 to 6 weeks, you would start seeing results. Like like when you go to gym, you don't get beefed up this next day. It takes time before your body starts getting built up. Similarly, these exercises also would take some time before the pelvic floor actually gets strengthened and before you actually start seeing some results. So be a little bit patient about it. Lastly, if your pelvic floor is already quite tight and you further do these exercises, it may actually harm you. So if you feel any kind of pain while doing this exercise or any other kind of issue, it is better to go and see a urologist first and do the exercises under his or her supervision. So I hope that I was able to give you some actionable information in this video. And if you are having erectile dysfunction or issues with erection, or if you want to increase the timing, you can safely use Kegels exercises. But if you face any issues, it is always better to do these exercises under supervision of a urologist. Thank you.